Graves' disease is an autoimmune disorder that primarily affects the thyroid gland, leading to its overactivity, a condition known as hyperthyroidism. Recognizing the early warning signs is crucial for timely diagnosis and management. In this video, we'll explore the subtle and more obvious symptoms that can signal the onset of Graves' disease. Understanding these signs can help individuals seek medical attention sooner, potentially preventing complications. Let's begin by looking at what Graves' disease is and why early detection matters. Graves' disease is an autoimmune condition where the immune system mistakenly attacks the thyroid gland. This causes the gland to produce too much thyroid hormone, affecting various body systems. The thyroid, located at the base of your neck, plays a vital role in regulating metabolism, energy, and overall health. When overactive, it can lead to a range of symptoms that may develop gradually or suddenly. Understanding the basics of Graves' disease helps us recognize its early warning signs more effectively. Catching Graves' disease early can make a significant difference in treatment outcomes. Early intervention can help manage symptoms, reduce the risk of complications, and improve quality of life. Many early signs are subtle and easily mistaken for other health issues, so being aware of them is essential. In the following scenes, we'll break down the most common early warning signs, starting with changes in energy levels and mood. One of the earliest signs of Graves' disease is unexplained weight loss, even when appetite and food intake remain the same or increase. This happens because excess thyroid hormone speeds up metabolism, causing the body to burn calories faster than usual. If you notice a sudden drop in weight without trying, especially if accompanied by other symptoms, it's important to consult a healthcare provider. Weight loss can be gradual or rapid, depending on the severity of hormone imbalance. Another early warning sign is an increase in appetite. People with Graves' disease often feel hungrier than usual, yet may still lose weight. This paradox occurs because the body is burning energy at a much faster rate. If you find yourself constantly hungry or eating more than normal without gaining weight, it could be a sign of an overactive thyroid. Monitoring changes in appetite alongside other symptoms can provide important clues. Graves' disease can significantly impact mood and mental health. Early on, many people experience increased nervousness, anxiety, or irritability. These emotional changes are often mistaken for stress or other psychological issues. The excess thyroid hormone stimulates the nervous system, making it difficult to relax or feel calm. If you notice persistent feelings of anxiety or mood swings without a clear cause, it may be worth discussing with your doctor. Alongside anxiety, irritability, and mood swings are common early signs of Graves' disease. You might find yourself becoming easily frustrated or upset over minor issues. These emotional shifts are due to the hormonal changes affecting your brain and nervous system. If you or someone close to you notices a change in your temperament, especially when combined with other symptoms, it's important to consider a thyroid evaluation. Despite increased energy and restlessness, many people with Graves' disease feel unusually tired or weak. Fatigue can set in quickly, and muscles, especially in the upper arms and thighs, may feel weak or easily fatigued. This combination of hyperactivity and exhaustion is a hallmark of thyroid hormone imbalance. If you're experiencing persistent tiredness or muscle weakness, it's a good idea to seek medical advice. A subtle but important early sign of Graves' disease is the presence of fine tremors or shakiness, especially in the hands and fingers. These tremors are caused by overstimulation of the nervous system due to excess thyroid hormones. You might notice your hands shaking when holding objects or performing delicate tasks. If this symptom appears alongside others, it's worth mentioning to your healthcare provider. Graves' disease often causes the heart to beat faster than normal, a condition called tachycardia. Some people may also experience irregular heartbeats or palpitations. These symptoms can be alarming and are a direct result of increased thyroid hormone levels. If you notice your heart racing or skipping beats, especially at rest, it's important to get checked by a doctor as soon as possible. People with Graves' disease often become more sensitive to heat. You might find yourself sweating excessively or feeling uncomfortable in warm environments, even when others are fine. This intolerance to heat is due to the increased metabolic rate caused by excess thyroid hormone. If you notice you're sweating more than usual or can't tolerate warm temperatures, it could be an early sign of thyroid dysfunction. Excessive sweating is another early symptom of Graves' disease. Even in cool environments or without physical activity, you may notice you're sweating more than usual. This is a direct result of the body's increased metabolic activity. If you find yourself frequently sweating without a clear reason, especially with other symptoms, it's worth discussing with your healthcare provider. Graves' disease can speed up many bodily processes, including digestion. As a result, people may experience more frequent bowel movements or even mild diarrhea. This change is often overlooked or attributed to diet, but when combined with other symptoms, it can be a clue to thyroid overactivity. If you notice a persistent change in your digestive habits, it's important to mention it to your doctor. Women with Graves' disease may notice changes in their menstrual cycles. Periods can become lighter, less frequent, or even stop altogether. These changes are due to the hormonal imbalance caused by an overactive thyroid. If you experience irregular periods or other menstrual changes, especially with additional symptoms, it's important to consider thyroid testing. A decrease in sexual desire, or reduced libido, can also be an early sign of Graves' disease. Both men and women may experience this symptom as a result of hormonal changes affecting the reproductive system. If you notice a persistent drop in sexual interest, especially alongside other symptoms, it's worth discussing with your healthcare provider. Difficulty sleeping or insomnia is a common early symptom of Graves' disease. The increased energy and nervousness caused by excess thyroid hormone can make it hard to fall asleep or stay asleep. If you find yourself tossing and turning at night, or waking up feeling unrefreshed, it could be related to thyroid dysfunction. Sleep disturbances often go hand in hand with other symptoms like anxiety and fatigue. One of the most distinctive features of Graves' disease is its effect on the eyes. Early on, you might notice mild eye irritation, dryness, or a gritty feeling. Some people experience excessive tearing or sensitivity to light. These symptoms can progress, so it's important to recognize them early. Eye changes are a hallmark of Graves' disease and should not be ignored. As Graves' disease progresses, some people develop a condition called exophthalmos, where the eyes appear to bulge or protrude. This is due to inflammation and swelling of the tissues around the eyes. While not everyone with Graves' disease experiences this symptom, it is a classic sign and should prompt immediate medical evaluation. Early detection can help prevent further complications. In addition to bulging, the eyes may become red, swollen, or puffy. This can be accompanied by discomfort, pain, or a sensation of pressure behind the eyes. These symptoms are caused by inflammation and are more common in people with Graves' ophthalmopathy. If you notice persistent redness or swelling in your eyes, it's important to seek medical attention. Some individuals with Graves' disease may experience double vision, also known as diplopia. This occurs when the muscles controlling eye movement are affected by inflammation. Double vision can be intermittent or constant and may worsen over time. If you notice changes in your vision, especially double vision, it's essential to consult an eye specialist promptly. Increased sensitivity to light, or photophobia, is another early eye-related symptom of Graves' disease. Bright lights may cause discomfort or pain, and you might find yourself squinting or avoiding well-lit environments. This symptom, especially when combined with other eye changes, should prompt a thorough eye examination. A visible swelling at the base of the neck, known as a goiter, is a classic sign of Graves' disease. The thyroid gland becomes enlarged due to overstimulation by the immune system. Goiters can vary in size and may or may not cause discomfort. If you notice a lump or swelling in your neck, it's important to have it evaluated by a healthcare professional. Some people with Graves' disease experience a sensation of tightness, fullness, or discomfort in the neck area. This is often due to the enlarged thyroid gland pressing against surrounding tissues. If you feel persistent neck discomfort, especially with visible swelling, it's important to seek medical advice. An enlarged thyroid can sometimes make swallowing difficult or uncomfortable. This symptom, known as dysphagia, may be mild or more pronounced depending on the size of the goiter. If you notice trouble swallowing, especially with other thyroid symptoms, consult your doctor for further evaluation. Changes in your voice, such as hoarseness or a raspy tone, can occur if the enlarged thyroid gland presses on the vocal cords. While this is less common, it's still an important symptom to watch for. Persistent voice changes should always be evaluated by a healthcare professional, especially if accompanied by other signs of thyroid dysfunction. Graves' disease can affect hair health. Early on, you might notice thinning hair, increased hair shedding, or changes in hair texture. Hair may become brittle or break easily. These changes are often gradual and may be mistaken for normal aging or stress. If you notice significant hair changes, especially with other symptoms, consider thyroid testing. Skin changes are another early warning sign of Graves' disease. The skin may become warm, moist, or unusually smooth. Some people develop patches of thickened red skin, especially on the shins, a condition known as pretibial myxedema. If you notice unusual skin changes, it's important to discuss them with your doctor. Pretibial myxedema is a specific skin condition associated with Graves' disease. It appears as thick, red, or swollen patches on the shins and tops of the feet. While not everyone with Graves develops this symptom, it is a distinctive sign. If you notice these skin changes, especially with other thyroid symptoms, seek medical evaluation. Fine tremors in the hands are a classic early sign of Graves' disease. You may notice your hands shaking slightly when holding objects or extending your arms. This symptom is due to the overstimulation of the nervous system by excess thyroid hormones. If you observe persistent hand tremors, especially with other symptoms, consult your healthcare provider. Graves' disease can cause your reflexes to become more brisk or exaggerated. During a physical exam, your doctor may notice that your knee-jerk or other reflexes are more pronounced than usual. This is another sign of nervous system overactivity due to excess thyroid hormone. High blood pressure, or hypertension, can develop as an early sign of Graves' disease. The increased metabolic rate and heart activity put extra strain on the cardiovascular system. If you have unexplained high blood pressure, especially with other symptoms, it's important to consider thyroid testing. Even when you're resting, Graves' disease can cause your heart to beat faster than normal. This persistent increase in heart rate, known as resting tachycardia, is a direct result of excess thyroid hormone. If you notice your pulse is consistently high, it's a good idea to have your thyroid checked. Some people with Graves' disease experience shortness of breath or difficulty breathing, especially during physical activity. This can be due to increased heart rate, muscle weakness, or swelling in the neck. If you notice unexplained shortness of breath, it's important to seek medical evaluation. Graves' disease can cause you to urinate more frequently than usual. This is partly due to increased blood flow through the kidneys and higher metabolic activity. If you notice you're visiting the bathroom more often, especially at night, and have other symptoms, it may be related to thyroid dysfunction. Along with frequent urination, you may notice increased thirst. This is the body's way of compensating for fluid loss. If you're drinking more water than usual without a clear reason, and it's accompanied by other symptoms, it could be an early sign of Graves' disease. Some people with Graves' disease notice swelling in their hands or fingers. This can be due to fluid retention or inflammation. Swelling may be mild or more pronounced and can come and go. If you notice persistent swelling, especially with other symptoms, it's important to seek medical advice. Graves' disease can make you more sensitive to loud or sudden noises. This heightened sensitivity is due to the overstimulation of the nervous system by excess thyroid hormones. If you find yourself easily startled or bothered by noise, it could be related to thyroid dysfunction. A feeling of restlessness or being unable to sit still is common in the early stages of Graves' disease. You may feel the urge to move constantly or have trouble relaxing. This symptom is a direct result of increased metabolic activity and nervous system stimulation. Many people with Graves' disease find it hard to concentrate or focus on tasks. This difficulty is often described as brain fog and can affect work, school, or daily activities. If you notice persistent trouble with memory or concentration, especially with other symptoms, it's important to seek medical advice. Emotional instability, such as frequent mood swings, crying spells, or feeling overwhelmed, can be an early sign of Graves' disease. These emotional changes are due to the impact of thyroid hormones on the brain and nervous system. If you notice significant changes in your emotional state, it's important to consider a thyroid evaluation. Excess thyroid hormone can lead to bone loss, increasing the risk of osteoporosis. While this is more of a long-term complication, early signs may include bone pain or increased risk of fractures. If you have other symptoms of Graves' disease and notice bone discomfort, it's important to address it with your doctor. A family history of thyroid disease or autoimmune conditions increases your risk of developing Graves' disease. If you have close relatives with thyroid problems, it's important to be especially vigilant for early warning signs. Other risk factors include being female, under age 40, or having other autoimmune diseases. If you notice any combination of these early warning signs, it's important to consult a healthcare professional. Early diagnosis and treatment can prevent complications and improve your quality of life. Don't ignore persistent symptoms, especially if they're affecting your daily activities or well-being. To summarize, the early warning signs of Graves' disease can include unexplained weight loss, increased appetite, nervousness, fatigue, tremors, rapid heartbeat, heat intolerance, eye changes, goiter, and more. Recognizing these symptoms early can make a significant difference in managing the condition. Stay alert to changes in your body and seek medical advice if you have concerns. Being aware of the early warning signs of Graves' disease empowers you to take charge of your health. If you or someone you know is experiencing these symptoms, don't hesitate to reach out to a healthcare provider. Early intervention can lead to better outcomes and a healthier future. Stay informed, stay proactive, and prioritize your well-being.